Primary care physicians are very frustrated, and frankly, it should be a wake-up call to us. Hello, I'm Dr. Stephen Schimpff, and this is part of a continuing series on the crisis in primary care. Now, what are all these frustrations about? Well, it's really about time. I've interviewed over 30 primary care physicians in depth from across the country, and they all tell me essentially the same thing. I just don't have enough time with each patient. And particularly my patients who are older or those who have one or more chronic illnesses that just really should have more time. So that's the root problem that they face, and they are incredibly frustrated about it. Now they have some other frustrations as well, and most of them relate to insurers. For example, every insurer has a different formulary for their drugs. So the doctor has to figure out what formulary to go to figure out what prescription to give you as a patient. Every insurer has a different mechanism for reimbursement. So they have to hire someone in the office who's trained to figure out from each different insurer how to send the bill in, how the coding has to work. These are very frustrating, very time consuming. There are other frustrations as well. Government rules, which the commercial insurers usually follow later, are really burdening physicians, not just primary care physicians. So for example, now everyone needs to have an electronic medical record. That's a great idea, it's important. But the government insists on what they call meaningful use. Well, that's the greatest oxymoron in the world today. Meaningful use is just one more drag on the physician's time. Most tell me they have to spend an extra hour after the end of the workday just getting all their records up to speed to satisfy the government. Similar to that are requirements to keep track of what are called quality care indicators. Again, a very important and useful marker, but it's another time sink. It's time away from the patient. These are the things that are causing frustrations. Let me read a quote to you from a physician out in the West Coast. She wrote this in the Daily Beast about a year ago. It went viral, actually. Simply put, being a doctor has become a miserable and humiliating experience. Indeed, many doctors feel that America has declared war on physicians, and both physicians and patients are the losers. It's hard for anyone outside the profession to understand just how rotten the job has become, and what bad news that is for America's healthcare system. Quite a damning thing, and that the article went on beyond that. So the root problem here is time, not enough time. And I want to talk to you more about that in the next segment.